Hello, Harry Brownlow, shoulder specialist. Today I want to talk to you about collarbone fractures or clavicle fractures. Fractures of the collarbone or clavicle are really very common, particularly as we get into the winter months when people start slipping and falling over. But the majority of them I see, I think, are in people who fall off their bikes, whether it's on-road or off-road. Now, if you have a collarbone fracture, it's usually pretty obvious. It really hurts, and you'll be able to feel where it's tender, and you'll have a good idea that's what's happened to you. And almost certainly you will have taken yourself off to casualty, and an ordinary old x-ray would have shown you that your collarbone has broken. You then have a question to answer about how you wish to have it treated. And there are two broad ways of managing it. Either you take the traditional route, which is to wear a sling until the bone heals and then go back to use your arm in a normal way. And this is the way that's been used across the world for millennia until very recently. It's highly successful. So if this is the route you want to take, any old sling will do, anything that provides you with comfort, and you'll need to take regular painkillers. And by about 6 weeks after breaking your bone, it will have knitted together such that you will no longer want to wear the sling and you'll be starting to use your arm quite normally. And after that it'll get stronger and the movement will become fuller, and within no time you'll return to full function with no problems, but just a lump to feel where you used to have a broken collarbone. But there is a new strategy, and that is to have an operation which puts a plate and screws onto the broken bone in order to reduce it all back together again, so that when it heals in the natural or nearly natural position. Now, for a long time we weren't sure which was best, whether to have an operation or not to have an operation, until about 10 years ago a very important study was performed in Canada, where they took people with collarbone fractures and let a computer randomly allocate those people into either having an operation or not having an operation. And the results were very clear. That is, those people who had an operation got better much quicker and had fewer complications than those who did not have an operation. But the study only included about 100 people, and there was quite a discussion about whether this was really a good and powerful enough study to help sway how we should manage people. And so I'm pleased to say this whole study has just been repeated here in London by one of my colleagues, but with a much bigger cohort of patients, now over 300. And again, they found exactly the same results. That is, if you have an operation, you'll get back to work quicker, you'll get back to sport quicker, you'll have less pain and improved function in the first few months, certainly. You're more likely to heal up in a good position, you'll have less cosmetic problems, and overall you're more likely to be happy if you've had an operation than if you haven't had an operation. But, and there's a big but here, after about 9 months or so, the two groups' results completely evened out. So that if you are of the philosophy that you'd rather not have an operation, for whatever reason that might be, then don't worry, that's still a perfectly justifiable way of managing your problem, and your end result will be every bit as good as if you'd had the operation. Were you to choose to have the operation, I would do this as day case surgery. By that I mean you'll be in and out of hospital on the same day, and you'll be done under a general anaesthetic, that is, you'll be asleep. I make a cut over the collarbone in a nice, neat, straight line, and as best as possible I gather together all the pieces, return them back to their original positions, and put a plate and screws on to hold them all back together again. When you wake up after the operation, which takes an hour and a half or so, you should not be in too much pain, because we can flood the whole area with local anaesthetic, and that's very good at controlling and managing the discomfort. You will go home in a sling, but next day I would encourage you to try and throw the sling away and start to move the arm, and you'll surprise yourself that you'll be able to lift your arm up without pain just within 24 hours of the operation. And most people will be able to get back to work and driving about a week after the operation, and then return to sport depends very much on the type of sport that you enjoy. So you could be on a stationary bike within a matter of a few days if fitness is very important to you. You could be out on the road riding gently after a couple of weeks, or even swimming gently after 2 or 3 weeks. And then more vigorous activity after about 6 weeks. But I wouldn't want you doing any collision or contact sport until we've got x-ray evidence that your fracture has solidly healed, and that may not be for 2 or 3 months. So those are your choices. Live with it or have an operation. There are pros and cons to both, and those you need to discuss with your shoulder surgeon.